First of all, what other questions do you have?
I can't think of any right this second, but I'm sure
How
I'll come up
long?
with some.
How long have you been trying to get pregnant?
Over 2 years.
2 years. And what fertility treatments have you done in the past?
None. I mean...
Okay. And we've reviewed a lot of detailed things that we've evaluated and discovered. We do understand that you have a significantly higher risk of endometriosis that we talked about because of anatomic reasons. We talked about issues relating to male factor. We talked about issues relating to sperm issues, sperm problems, and abnormal sperm counts. And everything right now is fine. Now, we've just completed your ultrasound. Your ultrasound today shows us that you're within 48 hours of ovulation. We can precisely time it. It's so perfect to see, the fact that you have such good follicles. You have 2 follicles, one on the left and one on the right. So you have a 25% chance that if you do get pregnant this cycle, that you'll have twins. So is that good or bad?
That's scary.
Okay, and basically, if you do not surge by tomorrow, then I'll write this out, then you need to take the shot of HCG. It's called Avidrel. And it's called Avidrel because it's biosynthetic but natural, but bioidentical but synthesized by recombinant DNA technology, and it's bioidentical to the hormone that triggers ovulation.
Okay.
It's the best product made in the world, and you take 2.25 of that sub-Q, 1 dose. You take this tomorrow. I'll put here with needle and syringe. You'll take this tomorrow if you do not surge on your own tomorrow morning. And you can take this anytime from midday until closer to dinner time is fine, in the afternoon or dinner time.
Okay.
And then that's Saturday, and then you'll have the insemination on Monday.
So on Monday morning, Jeff would need to go into the clinic and give his sample.
Yes.
They'd wash it, and then I'd come to you.
It takes about 90 minutes to wash the sample.
Okay.
And then you bring the sample to me. We'll make an appointment with Pat, and then we'll do a simple insemination. You need to rest for about 15 minutes after the insemination. You should also have intercourse the day before the insemination and intercourse the day after, so you have a homework assignment.
Okay. That works.
Okay, so that's the
We studied last night.
That's good. Okay, and this I'm going to put here.
Even though they say on the that they want at the clinic, they recommend abstaining 2 days because he doesn't have a low sperm count.
He doesn't have a low sperm count. As long as we have 10 million sperm after the wash, the pregnancy rates are stable for 10 million of motile sperm.
Okay.
Total motile count of 10 million, and it makes no difference. But we want to make sure that your system is saturated with sperm both before and after the insemination. Remember, if you don't get pregnant by the 3rd cycle, we're going to recommend going to assisted reproduction or a laparoscopy first, which would be the smart thing. And so that would complete your treatment cycle now. All you have to do is, if you don't surge tomorrow, take this dose subcutaneously. If you do surge tomorrow, then you don't need anything except you've got to schedule with the fertility center and do the insemination on Sunday.
Okay. And you're not going to be the one to do that? They'll do it?
They'll do it. They'll have a nurse practitioner who'll do it.
Okay.
And so you have to call them before they close today to set that up for a potential for Sunday.
Okay.
Okay.
I'm keeping my fingers crossed that that's not the case.